Hi, welcome everyone. So while we're waiting for the other participants, please feel free to scan this QR code using your phone and fill out a very short and brief pre-event survey. I'll just give it a few minutes for other people to join. Hi, thanks for everyone for joining today's event. Asking the expert anything you want to know about the Australian health system. So while we're waiting for the other participants, please use your phone to scan this QR code and fill out the pre-event survey. This would help us in understanding who you are and what you like to know, and it gives us a good evaluation of how we're doing with the survey. Thanks. If you have any questions about how to do the survey, feel free to ask in the chat and just wait a few more minutes for people to join. So if you're struggling to scan the QR code, we have sent out the link to the survey in the chat. You can also click on the link in the chat. Yeah, for those of you who just came in, we're just waiting for a few more minutes for more people to join. And if you could please scan this QR code or click the link that's in the chat to complete our pre-event survey, that would be greatly appreciated. Thanks. All right, so we'll get started with today's event. Before we get started, I'd like to take a moment to acknowledge the Bidjigal people that's the Gadigal people and the Ngunnawal people were the traditional owners of the lands where each campus of UNSW is situated. We pay our respect to the custodians of various unceded lands on which we work, study, and meet today, and the Aboriginal and Torres Strait Islanders people meeting with us here today. And we'll start with introducing all of our lovely panelists. So first of all, Dr. Monique, who's the head of UNSW Health Service, Renee, who's our clinical lead of UNSW Psychology and Wellness, Sabrina, who's our partnership and commercial manager from Medibank, and so I'm one of the health partnership support officers from Medibank and also a fifth year medical student at UNSW, and Elisa, who's another one of the health partnership support officer from Medibank and a final year student of Bachelor of Commerce from UNSW. So now this whole event will be an hour long. The first 30 minutes will be made up of presentations. We have all of our three lovely panelists who will introduce us to their service, including UNSW Health Service, UNSW Psychology and Wellness Service, and Medibank OSHC. And then there will be a 30-minute Q&A time where our panelists will answer questions being asked in the Q&A function on Zoom. So if you now have a look in your chat functions, you can ask questions anonymously by addressing to host and panelist. And please be aware if you address to all participants, that will appear to everyone who's participating. So if you want to ask some questions anonymously, please only address to host and panelist. And I encourage all of you now to start submitting your questions using the chat function. Our panelists will try their best to answer the questions towards the end of the sessions. So I'll start by introducing our first panelist, who's Dr. Monique Akori, who is the head of UNSW Health Service. She is now the practicing GP on campus with an interest in women's health, sexual health, and chronic health diseases. She is also an adjunct lecturer from UNSW. Now I'll hand over to Dr. Monique.
Thank you. Hi, everyone. Thank you for joining us today, and thanks for the introduction, Ellen. So as Ellen said, my name is Monique Akuri. I'm the head of the health service here, and I also work as a GP here. So I do 2 days a week where I see patients, and then I do lots of other things for the health service on the other days. So I've had a look at some questions that people have submitted before the session today, so thank you for doing that. And I've tried to incorporate some of my answers to those within some of my slides, but very happy for more questions at the end as well. So here at the health service, we're a big practice. You can see two of our nurses here. We've got 3 nurses that are on every day. We have a full-time mental health nurse that works here as well. We have a few psychiatrists that work just 1 day a week. And we've got 18 GPs, both male and female GPs that work here. GPs here, a few of them speak other languages. They speak Mandarin, Shanghainese, Greek, and French. And I will show you our website in a minute, and you can see on the website which languages different GPs speak as well. It's important to know that we don't link or share your records with the university, and we have confidential privacy policies. So when you sign up for our practice, it stays between you and our GP practice. And if we refer you to external people, then we might write a letter with health information to say send you to a psychiatrist or something, and we would get your consent for that. Next slide, please, Ellen. So this is the Kensington campus map. We're right in the middle. We're in the quad, on the eastern side of the quad, on the ground floor, and the psychology and wellness department is on the second floor. There's actually an internal lift that goes from the ground floor where we are up to the second floor where they are. And if Ellen goes to the next slide, we can have a nicer shot than just a map. So if you see the eastern side there where the mouse is hovering over, our entrance is just over there. So you know where to go to find us. Next page, please. So I'm not going to run through this whole video, but if you go to our website, as I said, which I will show you in a minute, there's a 3-minute video under international students in Chinese, and then a version in English under domestic students, where you can actually have a little bit of a look inside what the health service looks like. and it runs through a little bit about the health service as well. So that's something, it goes for about 3 minutes, so we won't go through it now, but something good to know that it's on the website that you can have a look at. Thank you. Next slide. All right, so Sabrina from Medibank will talk about billing in a little bit more detail, but just to give you an idea from an overall perspective, bulk billing is a term that we use for students when they come to see the doctor. The appointment gets paid for them so that there is no out-of-pocket expense for them to be seen. Now, if you are an Australian resident, you have a Medicare card, it means that when you come here and you give us your Medicare card, you get seen by the doctor, and then after the appointment, Medicare gets billed for that appointment, and that's how the University Health Service gets money for that appointment. For overseas health cover, instead of Medicare giving us that amount of money, we get that money from Medibank or from another external private health insurance OSHC provider. Now, for example, with Medibank, AHM, Allianz, and Bupa, it happens automatically once you've given us your card details. So there won't be a cost to be seeing the GP for a standard appointment when you come here. There are some more obscure overseas healthcare cover insurance providers, and with those, in some cases, so not the ones listed here, you might need to pay upfront first, and then you take your receipt to your overseas health insurance provider, and then they look at what they can reimburse you from that. Iron infusions are something that we would potentially do for people, and for that there is a $50 out-of-pocket cost. It's a sort of expensive thing to be doing with all of the technical equipment that we need, etc. And we do the actual procedure for an implanon, which is a contraceptive device that sits in the arm, or the IUD, which is inserted into the uterus. The GPs here for students are happy to do that bulk bill, no out-of-pocket cost for the procedure, but you do have to buy the medication. So you would buy the implanon or buy the IUD contraceptive device. And I might talk in a bit more detail about that after Sabrina has spoken. If people need to get an X-ray or an ultrasound, there's lots of different places that can be done that isn't actually on campus. We don't have those services on campus. So we have an arrangement with Spectrum Imaging Randwick that if you have a Medibank card, when you go to the High Street Spectrum Imaging up in Randwick, there's actually two up there, they would tap your Medibank card in a similar way that they would for coming here for an appointment. So there's no needing to pay that upfront cost. And there's lots of things that international and domestic students would be bulk billed for because of our arrangement with them. So, for example, a pelvic ultrasound to look at the ovaries and the uterus, that would be at the bulk billing rate. An X-ray would be at a bulk billing rate. A CT scan would be at a bulk billing rate. More specific tests such as an MRI, there would be an out-of-pocket cost, which is a normal thing to be happening here. Next page, please. So just a little bit about the Australian healthcare system. So made up of, this was in response to answering some pre-questions. So the health system is made up of doctors, so GPs, which stands for general practitioners, and specialists such as every part of the body system you can think of: psychiatrists, dermatologists, lung specialists, heart specialists, etc. And then there's allied health, so psychologists, dietitians, physiotherapy, podiatrists, which is foot specialists, lots and lots of different things. You can see doctors either in a community setting, which is, say, a GP practice, or a GP can refer you to a specialist in their private rooms, or a hospital setting, which is an emergency specialist clinic. Which is where, so in a hospital setting, there's emergency departments, and there's also specialty clinics within a hospital setting. If you go to the next page, please. So I'll flick to our website. It's to make an appointment with our through our website, you end up needing to become a member of a booking platform called HotDocs. So let me just show you. This will stop others sharing. Yes, so we'll go away from that for a minute. Okay, so as you can see over here, if you just Google the UNSW Health Service, you will find our landing page, or this is the link up here, student.unsw.edu.au/HSU. Ellen, could you pop that in the chat for everyone, the website link, if possible? So this is our landing page. We have different types of appointments you can book. A stock standard appointment, you would click on book appointment, and then book appointment via HotDoc, which is our platform. As you can see, then you come to different things that you can book. You can book directly for a flu clinic. You can actually book, we've created something to reduce the wait for an STI checkup appointment where you can book directly and you get allocated a doctor for an STI clinic appointment. We try to make those with 1 week or less wait. So that would be clicking on this one. But for standard, you can book for a COVID vaccine, and then for standard appointments, you can book for GPs by clicking and then going through and booking the appointments that way. So all of this will prompt you to make a HotDocs account, which is then how you can book appointments online. You can also call us and make an appointment. Now, we do have other information on our website, so it's worthwhile having a look, for example, at the different areas. You can see the video, you can get more appointments about information, how to make an appointment, emergencies, after hours care. We do have a list of other medical practices if we don't have a doctor available. So we do try to reserve a few, we do try to reserve some appointments for on the day that we open up in the morning. So advising people to call around 8:30 for those appointments. And we do have a system where if something serious is going on and someone needs to see a doctor, they can walk in, but we keep that for if something very serious is happening, because we do have an appointment-based system. So Ellen, I'll get you to go back to my slide, which means that in order to see a doctor, by and large, you need to go online and you need to make an appointment to see a doctor. A walk-in system just wouldn't work if everybody walked in for the way we run the practice. So we would reserve that for very specific cases of someone who needed to see a doctor that day. But if somebody is sort of acutely unwell, then we would recommend going straight to the emergency department, and I'll show you a map for that in a minute. So I think I've said point 3 there. We've got the alternative GP practices as well. For a first HPV vaccine, you need to book that with a GP. Then after for that, you can book directly with the nurses. I've mentioned the STI clinics. All of our GPC mental health. Renee will talk to you more about the great mental health service they have. But we do also see patients for mental health. And if you do need to see a psychiatrist, then we would do a referral for a psychiatrist. You can't see a psychiatrist without the GP referral. And depending on the situation, it might be an internal psychiatrist here or an external psychiatrist. Internal psychiatrist, that we do have a limited capacity for this because we only have a few that work 1 day a week, and there is no out-of-pocket cost for that gets bulk billed. External psychiatrist would be needed in certain circumstances, and that would be like other specialties and out-of-pocket costs. Next slide, please. So I won't spend too much time on this page because I know I'll need to keep moving so we have time for questions at the end, but we do lots and lots here. So general health checks, referrals, blood tests, chronic and acute medical issues, wound reviews, mental health, care plans, which I can go into more detail about at the end if need be, drug and alcohol concerns. We have doctors who specialize in skin checks, so I don't do skin checks personally, but if you look on our website, you can see the different areas. If you want to book skin check, you would book skin check and it would direct you to someone who does skin checks. Next page. Sexual health testing. If you don't want to go through the STI clinic for your sexual health testing, you can still book directly with any of the GPs for STI testing, and they're all very well practiced in doing that sort of treatment and testing. contraception, pap smears we do. You don't need to see a gynecologist for that. Iron infusions, pregnancy care. Some of our GPs manage pregnancy care later on down the track, and we all manage early pregnancy care. Travel medicine, we do lots of that, lots of vaccinations and special consideration forms, and medical certificates as needed as well. Drug and alcohol, I think I put in twice. Next page, please. So the Prince of Wales Hospital has a new emergency department that's been around for about two years. And if you go up Eastern Way to top of campus, you've got Botany Street. Off Botany Street, as you can see, there is a street called McGill Street, which is the entrance. You might find that you would see a GP here sometimes, and they would actually refer you to emergency with a letter. But you don't need a letter to go to emergency. So you can just show up in emergency if you have a severe problem. For example, if it's 6 o'clock at night and you're feeling like you can't breathe and you're having chest pain, we don't want you to wait until the next morning to see a GP, or even if that's happening at 2 o'clock in the afternoon. If you're having severe symptoms, then the safest thing for you to do is to go to hospital. I think that's really important to mention. If you're on campus, campus security can always be called as well, and I'll put the numbers for that in the chat, unless Renee has them in hers. But I think it's really important to know that as well. So our phone number is on the front page as well. And if you're not sure of anything, you can always call us. You can always walk in and have a chat about booking an appointment, about seeing what might be the appropriate thing to do. So yeah, we'd love to see you also come and see us. And we all work at the health service because we all have an interest in university health and student health, and we want to help you. So thank you.
All right, thanks, Dr. Monique,
Thank
for
you.
this very well description of the UNSW Health Service. Again, just a kindly reminder that if you have any further questions about Monique's presentation, feel free to pop in the question in the chat and she'll get to answer them towards the end of the presentation. And now we'll welcome Renee Griffin, who's a clinical lead of UNSW Psychology and Wellness. She also has a background in psychology and social work, and she's going to take us through the importance of mental health and well-being and the services available to support students in this area.
Excellent. Thanks so much, Ellen. Hello, everyone. As Ellen said, my name is Renee. Lovely to meet you through the Zooms. So I work in psychology and wellness, which is made up of 3 teams. If you are a student coming to our service for the first time, you will have contact with a team called Mental Health Connect. So they function as a bit of a triage team. So they will do assessments of levels of risk or how serious the things are people are experiencing is, and they will direct students to the appropriate avenues. So as a first step, what we generally do is ask students to fill out a pre-triage form, it's called, which should only take 1 or 2 minutes, and it's all private and confidential. It's just asking a couple of questions about maybe what you're noticing or what's compelling you to make contact with our service. And from that information, generally everyone will get contact from Mental Health Connect within 48 hours. I think 99% of the time. We just did some data and stats. So following that interaction, we would either directly book the person in with Mental Health Connect and they would do that assessment I talked about, or they would be referred, maybe if there's something very, very specific, to psychiatric care or something within the community. But we would do that in a kind of a warm way and direct the person and help facilitate that. In terms of urgency, as I was kind of alluding to before, it's kind of like if you have a sore toe and you go to emergency, although I wouldn't necessarily recommend going to emergency for a sore toe. That might be Monique's team a little bit more. But hypothetically, if you had a sore toe, you might be placed differently in the queue than someone who's struggling to breathe. So Mental Health Connect, what their job is with that is to figure out from the kind of mental health equivalent, where are the levels of the people who, mental health wise might be struggling to breathe. So if it's decided that being linked in to our service to a counsellor is the best thing for you, you will then go in and see one of our counsellors. So we've got a mixture of psychologists, clinical psychologists, mental health social workers, and occupational therapists. And they will provide really kind of goal-directed support around a variety of things. So we're a generalist service. Commonly, what we see is a lot of kind of low mood or people feeling anxiousness or stress. A big thing that we see with international students is, considering people are coming potentially from countries where the language is different, the culture is different, the university structure is different, the way you speak to your lectures is different, the personal space you have on a bus between someone is different. People are moving away from their supports and their friends and family in their home country. We do see a little bit of support required for international students who might just need a little bit of assistance figuring out how to adjust to this new kind of Australian context. So that's something we definitely see and something we see a lot of. Really common question that we get asked is how much? And the answer is free, or it's covered by your overseas healthcare provider. So we never charge. I kind of covered the urgent appointments available. The other thing as well, lots of international students might be coming from backgrounds where there's different understandings of how much your personal information is going to be shared. We are quite separate from the rest of the university. So unless there's an imminent risk of harm to yourself or others, we are not able to and absolutely don't share any of your personal information with lecturers or, societies or clubs or things like that. And another thing as well on that is that the Australian government definitely don't know if you see us. So in terms of visa implications, that's not something that anyone needs to worry about too. Next slide, please. So we have our service runs business hours 9 to 5. And the number to the left, the 93855418, is the number that you can call if you want to speak to us. And that can be about changing appointments once you've already put through the pre-triage form or a variety of things. But as soon as we tick over to after hours, so that's 5:01 p.m. to 8:59 a.m. the next day, public holidays, weekends, we actually have an after hours mental health support service as well. Additionally, after hours, there's the image on the right, there's a mobile number that you can text. And we find that a lot of international students who might not feel very comfortable speaking and might be a bit self-conscious of their English skills find the texting a really lower threshold to become linked in to receive support. So I definitely encourage people, if you feel speaking on the phone might be a little bit scary, that utilizing the text service is really worthwhile, and there's no limitations. You can text away constantly if you want at any time after hours. Next slide, please. I won't spend too much talking about this, just being mindful of the time, but Talk Campus is a peer-to-peer app that you can download, and if people want to get their phones out and scan the QR code, it'll take you to where you can download it. It is a peer-to-peer app where you are getting other students who are also potentially going through things as well, but also maybe just wanting to share how a particular class was going. It's a way to partially reduce mental ill health by decreasing isolation, which is something that we acknowledge that, can be quite normal to feel when you're first arriving in Australia and you're, still yet to make new connections. So Talk Campus is a really useful tool for that. Next slide. This page is probably a good one for people to take a photo of, just so that they can have that in their phones to reference back to. So it's got Mental Health Connect and Talk Campus that I covered. There's also student support services. The gendered violence response team is the third team in psychology and wellness that I manage. We've also got a specialist gendered violence counsellor as well. And that is about providing psychological support to people who might have experienced gendered violence. So that could be sexual assault, that could be stalking, that could be harassment, it could be domestic violence. We're really quite broad in our interpretation. And in the team, we also provide a little bit more in terms of practical support than just psychological support. So we have the ability, if the person wants, to go to the police with someone or to help them with emergency crisis accommodation if home isn't a safe place. We can also speak with the person to support them to making a complaint to the university if they want, and a variety of other things that I probably won't go into detail, but suffice to say it's good for people to know that we have a specific tailored support service for that as well. The Equitable Learning Service is about getting academic adjustments. If you need to take time off during exams to take some medication because you're diabetic or something, or if you are needing particular adjustments because of your mental health, that's the unit that you would make contact with. And I won't spend too much time on them, but they will assess the documentation you provide and then offer particular adjustments to try and minimize disruptions to your educational attainment and not limit you just because you're experiencing physical or mental health issues. Academic skills kind of says what it is on the tin. I think that's pretty self-explanatory. Special consideration is if something comes up that's outside of the realm of your control, but that prevented you from completing an assessment on time. And the health service, Monique's already spoken to in detail, so I won't speak any more to that. In terms of external mental health support, just quickly, there's various other services that can help as well. Again, probably not a bad slide to take a photo of. And a lot of those are 24/7 as well, as you can see. Next slide, that might be me. Yep, thanks.
Yep. Thanks, Renee, for this great summary of the Psychology and Wellness Service. Now move on to Elisa, who's a UNSW Medibank Partnership Support Officer, and she's going to take us over the Medibank OSHC summary. Hand over to Elisa.
Thanks, Ellen. So super happy to be here to talk to you about the Medibank OSH, or the Overseas Student Health Cover. Can you go to the next slide, please, Ellen? Thank you. So Medibank is the preferred overseas student health cover provider for UNSW international students, and our comprehensive OSH, or comprehensive overseas student health cover, is the premium product and is the preferred product for UNSW international students. Next slide, please. So first thing first, what's the overseas health cover? What is it? So in a nutshell, it's designed to help reduce or eliminate costs associated with hospital and medical needs while you are in Australia as a student. So there are four main pillars to OSH. First thing is doctor, GP, or specialist visits. And it includes x-rays or blood tests or just general consultants. As a side note, here at Medibank, we cover 100% of GP visits, and for specialist visits, we cover 80% of the MBSV. And the second pillar is prescription medicines, and I'll talk more about that later. Third one is emergency ambulance services, and here at Medibank, we cover 100% of the transportation, as well as the paramedic, or like the emergency care when you're in the transportation, like emergency vehicle. I know some of the providers only have the paramedics, but here at Medibank, we cover both paramedics and transportation. And lastly, we also cover hospital visits, and I'll talk more about that later on. Next slide, please, Ellen. So you may or may not have known, but we have a retail store here at UNSW campus, and it's right in a block house. So around a roundhouse, and it's in a block house. We have our store there, and it's open from Monday to Friday, 9:30 a.m. to 3 p.m. So yeah, if you have any questions, feel free to visit our friendly staff in stores. Any inquiries at all. Next slide, please. So what happens if you get sick? And Dr. Monique and Renee has talked about the out-of-pocket fee a little bit already, but just to explain it a little bit more, out-of-pocket fee is the fee that you have to pay extra from the MBS fee, which is a set of lists of the services that the government have already set out. If your doctor or the clinic that you go to charge a little bit extra, it's the out-of-pocket fee. And like I said, here at Medibank, we cover 100% of the MBS fee for GP visit or general doctor visit. And for specialist visit, we cover 85% of the MBS fee. My bad, I said 80 before, it's 85. Now if you get sick, to find a doctor, you can go straight to the Medibank OSH app and click on Find Provider, and it will lead you to a network of Medibank's direct billing clinics. So what that means is if you go to those clinics, you will be directly billed. So the bill will be directly sent to us, Medibank. So you wouldn't have out-of-pocket fee. And they can also give you prescriptive medications and refer you to a blood test, x-ray, or specialist doctor. And as a side note, the UNSW Health Service Clinic is also one of our booked bill clinics. Next slide, please. Now, this one has a little bit to do with the out-of-pocket fee again, but just a more detailed demonstration and explanation for it. So for example, you go to a GP and your GP charge you $51.20. So that thing bold here. What that means is that you only have to pay $10 out of pocket, and $41.20 will be paid by us. And there's a name for it. It's called the MBS fee. And it will be paid by us. So yeah, next slide, please. So the next one I want to talk about is pharmaceutical, or like medicines and vaccinations. So these four brands are generally the biggest brands for pharmacy in Australia. In Australia, we also call them chemists. And one thing to note about prescriptive medicines is that you always have to pay upfront. So always remember to bring the receipt home so that you can claim it back later on the app. Next slide, please. So this is an example of what you can claim or what benefits you have when you buy medication or vaccines. So this example right here is the HPV, or if any of you speak Chinese or have Chinese as your preferred language, is 9价宫颈癌疫苗. And I heard that it's super expensive in other countries, for example, China. But here in Australia, it only costs $220 per dose. And best things is if you're under 26 years old, you only need one dose for that. And if you're a Medibank member, you only need to pay $30 out of pocket, and the rest will be paid by us. So yeah, next slide, please. Okay, when should I go to hospital? So generally, you only go to hospital for medical emergency or pre-planned operations or procedures. In most other cases, your GP will be your first point of contact. But if you do need to go to a hospital, we cover 100% of unlimited emergency ambulance transport. So like I said, 100% of the transportation, as well as on-the-spot emergency treatment, so the paramedics. We also pay 100% towards the emergency treatment fees at public hospitals within Australia. So yeah. Okay, we also have the extra cover, which is not included under your comprehensive OSH, and that extra covers things like dental, optical, and physiotherapy. It's not included under your OSH right now, but if you're interested in wanting to know more about it or consider purchasing it, feel free to speak to our friendly staff, either by giving us a phone call right there or visiting our website where we have general information about extra cover, or you can always visit us in store in the UNSW retail store on campus. Now, what if your regular doctor is not available? Next slide, please. We have a 24/7 student health and support line, and it's 24/7, and it's for all UNSW international students, so you don't even have to be a Medibank member to call this support line. And we offer a tons of services for you, like medical advice from registered nurse, counselling services, emergency legal advice, and so much more. And one special thing is that we have the interpreter assistance, so kind of interpreting service in 160 languages, and it's available 24/7 for you. And best thing is, it doesn't have to be about medical purposes even. So for example, if you receive an employment contract and you don't really understand what it's saying, or if there's a line that you don't really understand, it sounds stretchy, then you're more than welcome to call the support line and we'll help you interpret it into your preferred language. So yeah, next slide, please. This is the Medibank OSH app that I've been briefly talking about. So this is how it looks like from your phone. And the app is useful because, one, you have access to a digital membership card, which means if you go to, say, one of our direct billing clinic, you wouldn't even need to bring a physical card. You don't even need to bring your wallet at all. You have everything on your phone with a digital card ready. And we also have this Student Rewards Plus, where if you launch it, it gives you a bunch of exclusive student discounts, as well as job opportunities via our job board. So next slide, please. This, if we can play this video by any chance, it's gonna show you how to quickly make claims in the app, how to activate the app. So yeah. So firstly, this is how to activate. You go in there, you need your passport, you need your certificate of enrollment, which will be in one of your email inboxes. And within that, you find your membership number. You also need your Australian card, like bank card. So fill in the form in the activate your membership card section, and then set your password. And then voila, you just need to log in, and then we're done. Now, within the app, we'll send your physical membership card into your Australian address within a few business days, about 10 business days. Now, how to search for Medibank OSH direct billing clinic. So you would open the app, click on search for provider, like I said, and it'll show you a bunch of network of clinics and GPs that we direct bill. Now, last but not least, how to make a claim. So same thing, open the app, there'll be a make a claim section, click on it, and then fill in the details and pop in the receipt as well as a proof. And then it will be refunded to you within a few business days. So yeah, just a little bit of statistics, numbers. We have more than 11,000 clicks that helped us save money on the student life. So that's part of the Student Rewards Plus that I tell you about in the app. And we have almost 3,000 Medibank members clicking on the job opportunities within the last financial year. So top deals, for the student discounts, we have Chat Time, Microsoft, Apple, JB, Hi-Fi, and so on. Whereas for the jobs, we have jobs from company like HP, Audi, McDonald's, Coles, and so on. So lots of interesting opportunities and student deals for you to explore within the Student Rewards Plus in the app. Next slide, please. Yeah, and last but not least, we have Living Healthy extra cover offer, like a discount at the moment. And it's one of the extra cover that I tell you in a previous slide, and it's basically it gives you one annual dental checkup and clean. It gives you unlimited ambulance services, and it gives you one flu vaccine shot a year. And this is a discount, an offer discounts that we're having at the moment for you, where we pay half the price for you, so that you only need to pay $99 for your first year with the Living Healthy extra cover. So yeah, it's only eligible for the first 1,000 international students at UNSW, and the offer ends at the 28th of June. So lots of interesting things happening, lots of people interested. So you are interested as well, feel free to visit the retail store and we'll help you set up the Living Health Extras cover. Next slide, please. So last but not least, again, if you have any questions or if you would like to know more about the extra cover offer, or if you'd like to switch to Medibank, if you're with another provider, any inquiries at all, feel free to either call us or visit us in store on campus. And for general information, you can email us or you can pop into our website there to find out the general information about all the offers that's going on. So yeah, thank you.
All right, so I'm gonna stop sharing at this point. Thanks to Lisa. I hope everyone has a better understanding of OSHC now. And here comes our Q&A time. So we'll welcome all of our panelists back again and to address some of the questions being asked. If you have any further questions, feel free. It's now the time to pop it in the chat or Q&A function. So first question, how come some GP outside of UNSW Health unit charge for the first consult? How can we take advantage of OSGC by avoiding paying out of pockets for GP visits outside of UNSW Health clinic? Monique, do you want to answer this one?
Yes. So Alyssa and I sort of answered this to a certain degree. So if you come to the health service here, then there's no out-of-pocket fee for a standard consult. And then Alyssa directed to you guys finding places that are covered with Medibank as well. I can't speak for the other providers, but it will be base by base. So all of the other GP practices in Sydney, they set their own fees. So I have heard of some GP practices where the first consult you have to pay, there's an out-of-pocket fee, and then it's bulk bill rate after that. But there are lots of practices where there would be a fee every time you go. So it's really case dependent. And one thing I didn't mention that I should have just to tack on top of this answer is that by and large, when you see a specialist, if it's a specialist in the hospital setting or if it's a specialist in private, then there would be an out-of-pocket fee. There would be a proportion of that would be paid by the health insurance, Medibank or otherwise, but there would be an out-of-pocket degree out of that. There's a percentage that you would pay. So there's a few. I think that should answer that question. Next question, Ellen.
Yeah, there's another question regarding privacy as well. If you are an Australian citizen, does government or ADF have your health records?
Yes, so no health records are given to the government or ADF. If you apply to become a member of the Army and they wouldn't have a copy of your records, but they might ask your general practitioner some questions with your consent. But as a general thing, the records stay within the University Health Service, and they're not linked with the government, they're not linked with MyGov, they're not linked with the university or anything.
Thank you. And the next question probably addressed to Sabrina and Elisa. Could you please explain about pregnancy and birth service provided by the OSHC? There's a waiting period of 12 months. What does this mean?
Yeah, I can answer that. So in generally, like a general rule, because when the patient need to be admitted in hospital, there's a 12 months waiting period applies. So as a general rule, so for our UNSW Medibank policy holder, the good news is we actually waive the waiting period. So for pregnancy, like again, in general rule, even for domestic students or Australian citizens, so there's a 12 months waiting period applies to the baby was the due date. So basically for Medibank comprehensive holders study at UNSW, that 12 months period is waived.
Okay, thank you.
And it's very important after baby is born, need to add the baby to the cover as well in the first 60 days or so. Yeah.
That's quite a good news and very generous of Medibank to waive that waiting period. And next question coming up, what would be the best practice for an international student? Should we only see one GP for the duration of our stay in Australia, Monique?
Yes, I can answer that. So seeing a GP and who you feel like you're comfortable with is a very personal thing. So I would recommend sometimes, you can look at people's profiles and you can see them, but until you see the GP, you might not get a gauge of how well you feel like your care is going with them, or how comfortable you feel with talking to them about personal issues. Everyone who comes to the health service here, we try to book you back in with a GP that you've seen to go through your results, and you can request to see the GP in the future as well. Some GPs do have a longer wait time, so it's important to book in future to see them as well. The thing is, though, we all are happy to see other people's patients as needed as well. So I'm more than happy if you can't get in to see your regular GP, that if you're still coming to this practice, it works well because we can see what happened in the last visit. We do have your history and you don't have to start along at the same time. So it's good to see the same GP, but in reality, a lot of the GPs do work part-time as well. So you might not be able to get to see that GP. So it is good that then you can see another person in the practice. But at the end of the day, if you do need medical care, then you might need to see another GP sometimes if you can't get in.
Okay, thanks, Monique. And I'll just go through some of the questions being asked in the pre-registration process. So one question, I guess, addressed to both Renee and Monique. What are the differences between like a counselor, psychologist versus a psychiatrist? And what do I need to do to see a psychiatrist?
Okay, good. So I'll start with that, and then maybe Renee, you can jump in as well. So Renee, you can probably talk about mental health clinician space of things in general. And actually, to add on to what Renee said about how sometimes psychology want to see people, and then you would need to be provided a referral elsewhere or to be seen somewhere else. Often that comes back through to us. So in order to see a psychiatrist, you do need to see a GP for a referral letter. So there are a lot of things mental health wise that GPs can do. So we can prescribe antidepressant medication, we can prescribe anti-anxiety medication. But when things are a little bit more complex, we would refer you on. So we do want to see you and want to help you with that. There's something called a GP mental health care plan, which can give you subsidized visits where you can get a degree of the money back if we're sending you to an external provider. So you would see a GP to get that assessment done and look at everything, and then be referred to an external psychologist if the service that's provided by Renee's team, if you'd be best suited to something else. Renee, do you want to have a talk about psychology versus counsellors, etc.?
Yeah. So counsellor in Australia is not a protected term. Psychologist is, as is occupational therapist and mental health social worker. So we use the term counsellor in our service because we have so many types of mental health clinicians, but everyone is trained with their specific peak bodies. So in the community, if you were seeking mental health kind of talk therapy support, that's not to say counsellors aren't fantastic clinicians as well. It's just it's not as perhaps regulated, or their titles aren't protected rather. Whereas if you were coming to see someone in our service, we would just generically, our position titles within the organisation are counsellor, but that doesn't mean that we're not. Most of us are, I think all of us are post-grad qualified in our various professions. So it's not something to be concerning yourself with and getting amongst the weeds with if you're coming to see us. Everyone is sufficiently trained. And I suppose just adding on the back of what Monique was saying, one really easy way to distinguish between psychologist and psychiatrist, because they both kind of sound the same, is psychiatrists are also medical doctors who can prescribe medication just the same as GPs can, whereas no one else, so mental health social workers, occupational therapists, clinical psychologists, we don't.
Okay. Thanks, Renee and Monique. And definitely we're blessed by having these wonderful professional counselors on campus to support us mentally as well. Another question's being asked quite frequently is maybe regarding the OSGC. In case of emergency, will this cost if we visit the hospital emergency department or getting inpatient care, or will this be covered by Medibank?
Yeah, so I can answer that though. Yeah, again, like the general rule, so like in terms of go to ED, I think Elisa also covered, like, you know, a student of mine in the situation needed to call an ambulance. So under the comprehensive, also Elisa covered that for both transportation, or if the doctor, actually paramedics, they, you know, they assess you on spot, they might decide not to actually take you to the nearby hospital or ED. That's a different case. So they might just treat you on spot. That kind of a cost will be also covered by Medibank comprehensive cover. So if they decided to take you to the nearby hospital, or if you actually managed to go to the ED by yourself, just be mindful. There are private hospital versus public hospitals. Some of the private hospitals, they do charge a service fee. It's very similar to some of the GP clinics. They do have a kind of a service charge. So it's kind of it's different to, you know, on campus GP practice, they don't charge the service fee. So it's no out-of-pocket costs. But for some private hospitals, there are some out-of-pocket costs might incur. But for most private hospitals, and I do suggest a student can check the hospitals, which is part of the range of the Medibank network. So they work with us. So for example, like Prince Wales Hospital, they're part of our network. So they're our Medibank's partner hospital. So your student go to hospital emergency, like you know, ED like that. So they will reduce the cost for our students. But just again, be mindful, because when you go to the ED, you also need to, for example, pathology test. You need to do urine test. There sometimes are some cost, you know, beyond that MBS charge, which means that out of pocket charge.
Okay, thanks, Sabrina. And I think we have just a minute. So, Monique, do you want to address the ADF follow-up question? So, if it's
fine,
not UNSW Health, if you change your GP, does your medical record will be seen by ADF or government too, or no?
I think I did address that one. Did I? Yeah.
Yeah.
So
There was a follow-up question if that's not under UNSW Health Service. It's actually like another GP.
Oh, if it's another GP practice, exactly the same. So in order to be accredited as a GP practice, we need to make sure that we've got strict policies on privacy and confidentiality. So we would adhere to a similar thing to another GP practice.
Okay.
Thanks for
Thank
clarifying,
you.
Ellen.
And thank you. And
there's
just
one.
one last question in the Q&A. If I break my wrist from falling off my bike, should I wait for the next available booking on UNSW Health Service, or should I walk in? And how would I need to know how to get an urgent booking?
So that's a great question. So because it can be a little bit grey in people's minds what you do. So if you're riding your bike to uni and you're, you know, you're coming past and you slip and you fall over and you hurt your wrist, walk straight into the health service. So what we're trying to avoid is someone coming in who's had a sore ankle for a couple of weeks. If something's happening and then walking in, if something's happening there and then, and you're on campus, we want to see you and we want to be able to help you. And then you will be assessed by the nurses initially, a GP would look at your wrist, and then we would determine, maybe we would send you to hospital. Maybe your wrist is deformed and we're like, this needs surgery. Or maybe we think, maybe we can do an X-ray up the road and then take it from there. So that's a good question, just to give you a bit of an idea of what we do and don't see.
Okay, thanks very much, Monique. So now that's all the time we have for questions. So before we finish, please everyone just use your phone to scan this QR code again to complete our feedback survey. Tells us how we're doing with this event. And thanks so much. Yeah.
One more thing really quickly, Ellen.
Yeah.
If you did fall over and hurt your wrist and you were stuck and you couldn't walk to the health service, you would call campus security, and then they would determine if they would take you straight up to emergency or take you into the health service. That's it.
Okay. Very good point. And I believe we've already sent the number of the campus security in the chat, so feel free to save that on your phone in case of emergency. So we hope you've learned a lot from today's webinar. Please scan this QR code to finish our post-event survey. That would be really greatly appreciated. We would like to thank Dr. Monique from UNSW Health Service, Renee Griffin from UNSW Psychology Wellness, Sabrina from Medibank, and Elisa from Medibank and Health Promotion Unit for organizing this webinar, and all the attendees for joining us today. Please follow UNSW Health via the UNSW website on social media for updates on events and support information, which is the next slide. But thank you so much for everyone for coming today, and please fill out this post-event survey. And the links also in the chat. Thank you.
Thanks. Thanks, everyone.
Thank you.